Headaches and Hydrocephalus by Shine Charity. As you probably know from experience, head pain is common in hydrocephalus. Hydrocephalus is a complex condition. There's so much going on that can potentially cause headaches. A study in Bristol a number of years ago showed that around 1 in 10 people with hydrocephalus experience head pain, even when their shunt is working as well as it can. If any new symptoms appear, they need to be checked out, but not all head pain is shunt related. There are lots of different causes of head pain, and they're all treated and managed slightly, or in some cases very differently. Today we'll go through some of the types of head pain you may experience. These are the causes that we'll be looking at in more detail today. While we're looking at these, it's worth bearing in mind that anxiety makes pain worse, and we know that anxiety is something that affects a lot of people with hydrocephalus. When we're thinking about pain management, it's also useful to be considering anxiety management alongside other treatments. If you have a new programmable shunt fitted after a malfunction, it can take a while to become comfortable with the way the new pressure feels. Sometimes adjusting the setting of a programmable shunt can help, but it isn't always possible to get things as comfortable and functional as they've previously been. It can be frustrating to experience, and you might find yourself repeatedly asking for your shunt settings to be adjusted, trying to get a pressure that you're happy with. A period of raised pressure in the brain due to a shunt malfunction can permanently affect the compliance of the brain. Compliance is how well the brain tissue can accommodate changes in pressure. You could think of it as a bit like a sponge becoming stiffer and less able to spring back. If this happens, you unfortunately may not be able to return to the level of health, well-being and function you were used to before the malfunction occurred. In this case, pain management medications and techniques such as cognitive behavioural therapy can help you adjust to the changes. Shunts can sometimes remove too much CSF from the ventricles, and this is known as overdrainage. In infants and young children, overdrainage can occur after periods of rapid growth. Overdrainage can cause the ventricles to shrink down and become slit-like. It's rare in older children and adults because the compliance of the brain changes as we age, and the brain tissue around the ventricles in adults can resist the pressure changes caused by overdrainage. Where slit ventricle syndrome is present in older children and adults, it has persisted from childhood rather than newly developed. Slit ventricle syndrome causes a mixture of high pressure and low pressure headaches. There are frequent intermittent signs of shunt blockage or high pressure, which suddenly resolve, and head pain is common. A neurosurgeon will be able to recommend the right treatment, but medications can help with pain management. For example, the antidepressant amitriptyline or gabapentin, which can help treat nerve-based or neuropathic pain. More commonly in older children and adults, overdrainage causes low-pressure headaches, and here the head pain occurs without the changes to ventricle size that occur in younger children. Low-pressure headaches will usually come on when standing up for long periods of time and will usually be helped by a glass of water and a lie down. Because gravity affects the way shunts work, their function is affected by the positions we're in. Shunts don't drain upside down, drain less while lying flat, and drain more readily the more upright we are. If you find you feel okay in the morning, but a headache builds as the day goes on, this could potentially relate to overdrainage. We recommend speaking to your GP about a neurosurgery referral if overdrainage is suspected. If you have a programmable shunt, the settings may need to be adjusted. Unfortunately though, low pressure headaches caused by overdrainage aren't always easy to fix. Anti-siphon devices can be added to existing shunts to try and reduce the siphoning effect of being upright and where too much fluid is drained. There's a type of shunt called a gravitational shunt that can help. It has one setting for standing and another for laying down, again with the aim of reducing the siphoning effect when standing. If you lose lots of weight, you may need your shunt adjusting to compensate for the reduced abdominal pressure and to prevent overdrainage. It's also worth noting that strenuous exercise can lead to overdrainage and head pain. Exercise increases blood flow to the brain. That extra blood takes up space, which can cause the shunt to drain too much CSF, causing headaches. Build up your exercise levels gradually over time and keep well hydrated to help prevent overdrainage head pain on exercising. Shunts can also underdrain. If you find you wake up with head pain and feeling groggy, it may be that your shunt is not draining quite enough CSF overnight. Try an extra pillow, propping yourself up a little more in bed, or propping up the head end of the bed a few centimetres on small blocks to create more of a slope for your shunt to drain. Positions where your head is below your waist will also prevent your shunt from draining and may cause headaches, so avoid or reduce time spent head down for prolonged periods. For example, if you do yoga, you might want to find alternatives or spend less time in inverted poses like downward dog or headstands. If you gain a significant amount of weight, you may need to have your shunt adjusted to allow it to drain more CSF and compensate for the increased abdominal pressure. Bowel enlargement, for example due to constipation or gas, reduces the space in the abdomen, which may reduce CSF drainage capacity, i.e. cause underdrainage. To prevent your bowels from impairing shunt drainage, it's important to eat a varied diet rich in fibre, vegetables and fruit, and make sure you get treated promptly if you experience constipation. A large proportion of the brain and body is water. When the normal water content of your body is reduced, it upsets the balance of salts and sugar, which then affects the way the body functions. Headaches are a symptom of dehydration. People with hydrocephalus and shunts may be more affected by headaches when dehydrated. Dehydration is usually caused by not drinking enough fluid to replace what we have lost. We lose fluid all the time just by breathing, sweating, and going to the toilet. The temperature, humidity, the amount we exercise or otherwise exert ourselves, and our fluid intake, diet, alcohol and caffeine consumption can all contribute to dehydration. We can also become dehydrated by illnesses that cause fluid loss through vomiting and diarrhea or sweating from a fever. Diabetes can also increase the risk of dehydration. A fairly common concern is that the CSF being drained by your shunt needs to be replenished by drinking equal volumes of extra water. So just to reassure you, this isn't the case, and the fluid removed is simply reabsorbed into your bloodstream. Some tips to keep hydrated. Drink fluids regularly. You want to be drinking enough that your pee is pale and clear, unless you've been advised otherwise. Water and diluted squash are good choices, and foods with high water content can help boost your fluid intake, for example soups, fruits like melon and oranges, and vegetables such as tomatoes and cucumber. Drink more when there's a higher risk of dehydration. For example, if you're sick, have diarrhea, or you're sweating due to fever, or perhaps due to hot weather or exercise. Limit your caffeine intake to a maximum of 400 milligrams daily. That's between 4 and 5 cups of tea or instant coffee. Alcohol is very dehydrating, and people with hydrocephalus may be more sensitive to this and experience particularly bad hangovers. Space alcoholic drinks with water or soft drinks, and after an evening drinking, try to have a couple of extra glasses of water before bed. Headaches and grogginess in the morning can also be a sign of sleep apnea, a condition where obstructed breathing at night means carbon dioxide builds up in the blood instead of being exhaled. This leads to swelling of the brain, with feelings of grogginess, brain fog, and headache. People with spina bifida are more at risk, but it can affect anyone. Other symptoms include tiredness, snoring, tossing and turning, stopping breathing during sleep, which is something you may not know about but someone else may observe, waking gasping or choking in the night, or awakening with a dry mouth or sore throat in the morning. Lots of body systems are impacted by sleep apnea, including the brain, the cardiovascular and the immune systems. We have a page about sleep apnea on the Shine website where you can read more about it. If you think you might be experiencing sleep apnea symptoms, then see your GP to be referred for assessment in a sleep clinic. Waiting lists are quite long, so if you don't want to wait, you can get assessments done privately. The treatment for sleep apnea is usually very effective. Continuous positive airway pressure, or CPAP, involves wearing a mask that delivers a steady stream of air to keep your airway open while you sleep. If the head pain you experience is due to sleep apnea, the CPAP treatment should resolve it. Good sleep is important for everyone and can help prevent headaches due to tiredness. There's evidence that during sleep our brains flush out toxins that accumulate during the day, so your brain is then bathed in fresh fluid. And this process is thought to help protect brain function. The NHS Every Mind Matters website has some good tips for getting more restorative sleep. After meningitis, inflammation of the delicate meninges covering the brain can persist for a long time after the initial infection. This inflammation can cause significant head pain. Non-steroidal anti-inflammatory medications such as ibuprofen can be helpful, and they should always be taken with food to protect the digestive tract from bleeding. Paracetamol can be particularly effective as a painkiller when taken regularly. As we age, our visual acuity, or how well our eyes see, can change. Regular tests at the opticians can make sure you keep up with and correct any changes with the right prescription glasses or contacts. If eyesight that needs a prescription goes uncorrected, you may find you have blurred vision and headaches, as your eyes must work harder to see. Sometimes these symptoms might make you worry about shunt malfunction, but a new optical prescription can help. Eye checks are particularly important for people with hydrocephalus, as raised intracranial pressure can be picked up by looking at the back of the eye. Raised ICP can cause swelling of the optic nerve. This is called papilloedema, and if detected by your optician, it's important you have this investigated further to make sure your shunt is working well. Even if you had a recent eye exam that was fine, it's essential that you still get symptoms of shunt failure checked out. Don't assume that everything is okay now just because papilloedema wasn't detected then. If you regularly use screens, computers, mobiles, tablets, take regular eye breaks. 20-20-20 is a good rule to remember. Every 20 minutes, look at something 20 feet away for 20 seconds. Tension headaches are typically a constant pain on both sides of the head, neck or face, sometimes behind the eyes. You may feel like squeezing, like something is pressing on your head or being tightened around it. The affected area may be tender and your head may hurt more when touched. They can last anywhere from 30 minutes to several days. The pain can be caused by posture and muscle pain, eye strain, tiredness, dehydration, noise, or by tooth clenching and grinding. Depending on the cause, exercise such as yoga or Pilates can be very effective. You may need physiotherapy if the pain is caused by a particular weakness, imbalance or instability. Massage and hot or cold packs can also help by relaxing the muscles and releasing tension. Painkillers such as paracetamol or anti-inflammatories such as ibuprofen may also help. Amitriptyline is sometimes prescribed to help prevent tension headaches, but it takes time to work. Temporomandibular joint pain from tooth grinding and clenching can be relieved with a night guard from your dentist. Migraines are severe debilitating headaches where the blood vessels in the brain release chemicals that cause inflammation and pain. Migraine headaches may be associated with other neurological symptoms such as temporary paralysis on one side of the body or altered sensation, taste or smell. Some people experience visual disturbances known as aura, which might be flashing lights or sparkles or wavy lines. Blind spots or loss of vision have also been reported, and people can become very sensitive to light, sound and smells. Ringing in the ears, known as tinnitus, sometimes occurs, and nausea and vomiting are common. The causes of migraine aren't well understood. We do know it can run in families, and we know that some people with hydrocephalus will experience them. Where they occur in hydrocephalus, it's thought that migraines may relate to something called pulsatility. Blood is pulsed into the head in waves. The head is an enclosed space, and the reason that we can't feel those pulses is because our CSF is also pulsed in such a way that it cancels out the arterial pulses. If you look at this graph, it gives an idea of how this effect, called destructive interference, works. The red line represents the pulses of blood and the blue line represents the CSF. The peak pressure of one is the trough of the other, so they effectively cancel out, and what you get is this stable purple line. And that's effectively what's happening in a typical brain under typical circumstances. What we think can happen in hydrocephalus is that changes to the brain, including the compliance, mean that instead of the CSF dampening the arterial pulsing, it actually amplifies it through constructive interference. If this happens, people can experience painful throbbing and it can trigger migraines. The symptoms of migraine can be similar to those of shunt malfunction, but once a shunt has been checked and confirmed to be working okay, and a diagnosis of migraine is suspected, then treatments can be explored. There are lots of medications that are used to treat migraine, including triptans and propranolol. There's no easy way to predict which treatment will be most effective for you, so trial and error, or trial and improvement, is the most common approach. Usually you'll need to try a medication for around 3 months to be able to tell if it's working. This can be frustrating, and you may worry that the doctors don't know what they're doing, especially if you have to try lots of different medicines and doses to get something that works well. Try to bear with it though. Everyone is unique, and just trying different things is really the only way to find the right approach for you. Our brains can change throughout life through something called neuroplasticity. This just means that the brain can change in response to our experiences. It's not fixed. If pain lasts a long time, new pathways in the brain are formed through neuroplasticity. And the longer the pain lasts, the more hardwired these pathways become. The brain and body learn to stay in pain. This does not mean the pain is imagined, it means it's ingrained, and different ways to treat and cope with pain are likely to be needed once it becomes chronic. In acute pain, for example from an injury, our body produces endorphins, which are our natural feel-good pain-killing chemicals. However, with chronic pain, our brain seems to produce less endorphins, so we have less natural help reducing the pain. If you take painkillers for headaches on more than half of all days, you might find you start getting headaches when you then don't take medication. These are called rebound headaches. And once this vicious cycle begins, it can become difficult to break, and you essentially become dependent on the painkillers. To stop, you should get medical advice and support, and this will help you manage your pain while weaning off your medication. It isn't always possible to get rid of pain completely, but the goal of most chronic pain management programs is to help you find ways of getting on with your life, ways to do ordinary activities rather than allowing the pain to dictate what you do or don't do. Managing anxiety, learning to properly pace yourself, and setting goals regarding your everyday life are as important as medications in your treatment. Most dedicated pain management services will have a psychologist. Referral to one does not mean your doctor thinks you're imagining your pain. They know your pain is real. They want to help you cope with it. Chronic pain is a huge topic in its own right. It would need a whole presentation of its own to cover. There are specialist organisations that also have lots of good information, for example Action on Pain, the British Pain Society, Pain Concern and Pain Support. So what to do? Stay hydrated, protect your sleep following good sleep hygiene, have regular medication reviews, know your shunt, there's a good page on the Shine website about this. Seek medical help to get the cause of your head pain investigated. Always get suspected shunt malfunction checked as soon as possible. Once serious or dangerous causes have been ruled out, it's helpful if you can accept this, with the help of psychotherapy if needed. If you have headaches often, it can be useful to keep a diary. You can download one from the Shine website. Diaries are helpful for figuring out headache patterns, which can then direct treatment. If there is treatment available, be open to trying it, including things that might sound strange to you. For example, antidepressants like amitriptyline and epilepsy medications can be used off-label for different types of pain. Or non-medicine-based treatments like physiotherapy or cognitive behavioural therapy can be very effective if you're committed to the process. Unfortunately, not all pain has an obvious or easily treatable cause. You might need to try a lot of different things in different combinations to find out what works, and you may need to switch or adapt your pain management strategies over time. Anxiety or catastrophizing, always thinking the worst, can make pain significantly worse. No one has ever been able to just calm down when told to, but there are effective strategies to help manage anxiety, which can significantly help to cope with pain. And just to reiterate our core advice when it comes to head pain and other symptoms of shunt malfunction. If you think your shunt might be malfunctioning, go to your nearest accident and emergency department. Take your shunt alert card and your hospital passport, both available from the Hydrocephalus resources page on the Shine website. Thank you for listening. If you'd like more information, please visit the Shine website, www.shinecharity.org.uk, and there you'll find information about managing pain, headaches, and our contact details if you would like to get in touch for a referral to our health team.